There's a motorcyclist come around the bend and went off the road and hit the ditch. And
Okay.
Really, at the moment, he's pretty smashed up.
At the state's Emergency Communications Centre, a call for help has come in from the scene of a motorcycle crash 200 kilometres away in the Victorian High Country. Intensive care flight paramedic Matt is now on the way with an air ambulance crew to rescue the motorcyclist.
Fully departure, maintain upwind till advised, please take off.
Airspeed's alive.
Okay, is he awake?
What, he's awake yet?
Yeah, okay.
He looks in a bad way though.
We'll keep the helmet on, okay?
Maybe leave the helmet on. Leave the helmet on.
Yeah.
Don't do it. Yeah, just loosen it.
The accident victim reportedly has a collapsed lung and is in danger of going into respiratory arrest.
We suspect that perhaps a broken rib has punctured the covering of his lung, allowing air to come in around his lung. And the only way to relieve that is by putting a hole into the chest to allow that built-up pressure to escape. If you don't allow that to happen, that person will go on and die.
Dust everywhere.
The helicopter is landing at Mansfield Airport, where the road crew is waiting with their critically ill patient for Matt to take charge of the situation.
On the ground, 50.
What's going on? So I've got Gavin here, he's 57. Gavin was riding a motorcycle approximately 80 kilometres an hour. I failed to negotiate a bend.
Gavin was taking part in a charity ride when he lost control of his bike and crashed into rocks. His son Billy was travelling ahead of him at the time of the accident.
When I rocked up to the scene, I seen his bike upside down in the ditch, and it was, I didn't know if he was dead or alive. I was just telling him it's going to be all right. The ambos are on their way. Yeah, it was just a horrible feeling. Horrible.
Got a pelvic wrap on? Pelvic wrap on. Gavin, give your toes a wriggle for me, mate. Good man.
Miraculously, Gavin is showing few signs of external injuries due to his full leathers and helmet. But internal injuries are now threatening his life. A suspected collapsed lung is Matt's first priority.
Gavin, how you going, mate?
Pretty better.
Yeah. Mate, your oxygen levels are pretty low. I'm concerned you've collapsed your lung, which is why they put that needle into your chest, but it's not doing a great deal for you at the moment, mate. So we're going to try and give you a bit more pain relief and see how you go with that and see if we can get you to breathe better. And if you can't, I'm going to have to put you to sleep so we can take over your breathing and get you back to Melbourne, mate. Sound reasonable?
You're the boss.
Righto.
Gavin is very sick. He's got a really fast heart rate. He's got a really fast respiratory rate. His oxygen levels are very, very low, and his blood pressure's low as well.
Nice big best for me, Gavin. You're doing really well, mate. We'll give another 20 of ketamine, please.
I can do that.
So I'll attempt to do a needle decompression on Gavin first, and if I don't get the results that I want from that, then I'm going to be forced to take more drastic action.
So sharp out, guys. Sharp coming out.
Back in the Victorian High Country, motorcycle accident victim Gavin is in a serious condition with a collapsed lung.
Gavin! 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 Open your eyes. Good man, good man.
Using a decompression needle, Matt has attempted to release a life-threatening build-up of air from inside Gavin's chest cavity.
Righto, so ketamine's kicking in, sats are up to 84.
Still got a rest rate of 60.
Yeah.
But the procedure has made little difference. So Matt now has no choice but to try and put Gavin into a coma and take over his breathing entirely.
Gavin, I'm going to give you some medicine very soon. It's going to make you very sleepy. Your oxygen levels are still very low, so we're going to put that little tube into your mouth and we're going to fly you back to Melbourne in a moment, okay?
There is so many factors that make this difficult. I know that as soon as I take the mask off and he stopped breathing for himself, his oxygen levels are going to rapidly deteriorate, which could lead into cardiac arrest. So we've got to perform this procedure as quickly as possible.
Just lifting you up, bud. Sorry, bud.
Yeah, you're all right. Okay, I have the ketamine.
Yep.
So 2 mils, 20 milligrams. 1, 2.
Is everybody ready?
Yeah, we're ready to go.
If I don't get it right at this point, you know, the consequences are going to be dire. So we need to get it right first time. Just get ready.
That ketamine's on board.
Just turn that suction on and have it available for me, please.
Yeah, sure.
Up in the remote Victorian high country, flight paramedic Matt is trying to save his critically ill patient after an horrific motorcycle crash.
Righto, guys, so this is the plan. He has got oxygen sats at 74% at the moment, which is very low, obviously. So it'll be a one look. If I don't get a view straight away and he starts to desaturate very quickly, I'll pull out early and we'll go straight back to back valve mask ventilation. Is everybody ready?
With oxygen levels still too low, Matt puts Gavin into an induced coma and takes over his breathing.
Saturation is still holding.
Gavin's wife Sharon had been waiting at the charity ride finish line when she heard the news.
I'd been told that he'd been put in a coma, but I didn't know the extent of his injuries. It was bad. It was bad. We've been together for 30 years. He's my soulmate, I suppose. Yeah, he's my best friend.
We've got sats at 74 at this stage.
So there's a build-up of pressure from both air and also blood inside his chest there.
Gavin is still not responding to treatment, and time is now critical. With hospital 30 minutes away by helicopter, Matt has no choice but to carry out one of the most risky procedures that can be performed by paramedics in the field.
Now, he is likely going to tension with us doing this, so I would like to move fairly swiftly.
Radial pulse.
So the next thing that we need to do is what's called a finger thoracostomy, which is an invasive procedure where we make an incision into the side of the patient's chest so that any pressure that's built up inside surrounding the lung can escape out of the patient's chest. So sharp out, guys.
Sharp out.
He's a big boy, so locating his ribs can sometimes be quite hard, so we've got a fair bit of tissue to cut through. It's a fair way in.
Yeah, we'll just wait until Matt's
There you go. There's your hemothorax.
Yep.
The blood and air have been released from Gavin's chest. Now the team must wait to see if his oxygen levels have improved enough to get him into the helicopter.
There's definitely air coming out with each breath there. The bleeding seems to be slowing down as well, which is good. Righto, sats at 93. Can we have a unit of blood, please, mate?
Push this in.
The oxygen levels have improved, but Gavin's low blood pressure is now the problem.
Let's get that blood up and going. Get a 12-lead ECG, make sure we're not missing anything. I'm very concerned about Gavin. I've taken him from a high conscious state and I've put him to sleep. I've cut a hole in his chest, I've let air out, I've let blood out. I'm still very concerned for him. His blood pressure's low, his heart rate's fast, he's bleeding somewhere else. So what he needs is to be moving towards a hospital. Let's get him across and get him sorted. He needs to get to Melbourne. Now, I'm not putting a collar back on, but we are all aware that he's got potential for cervical spine injury. This should keep his head nice and in alignment. All right, guys, someone needs to hang on to the blood and someone needs to take control of the monitor.
At the Mansfield Airport, flight paramedic Matt is satisfied his critically ill patient Gavin is stable enough for the 30-minute helicopter trip to Melbourne's Alfred Hospital.
You right to go?
Yep. He's still critically unwell at this point, and so I don't want to hang around at scene. The patient needs to be in hospital with surgeons standing over the top of him. Can I just get someone to be in charge of squeezing this blood for me, please?
As well as a collapsed lung, Gavin's blood pressure is dangerously low.
Let's get him in and get him on the ventilator.
Matt also suspects the 57-year-old could be bleeding internally from his high-speed motorcycle crash.
So we need to get the fudge out of him. We've been here too long now. We just need to squeeze that blood into him as much as we can for the moment. Keep an eye on his SpO2, keep an eye on his blood pressure.
Squeeze that in. We want to try and get that BP sorted. Low as possible, please, on the way back. Cool.
The helicopter needs to stay at a low altitude to prevent any further pressure build-up inside Gavin's chest.
I still have no lung inflation on this side. I cannot feel his lung.
This is a physically and mentally exhausting job. I've made decision after decision after decision with this patient at this stage, and so my brain is going at 1,000 miles an hour. He's still very, very unwell. He's still in a uncontrolled environment in the inside of the helicopter. You know, he still has the potential for things to go wrong with him.
Not like what his BP's doing again at Punctured. Below 150 coming down.
When we talk about what I enjoy in this job, I enjoy going to work and helping people when they really need it.
Thanks, guys. Thank you.
So when we land at the Alfred and I can see the medical staff and the medical team come to assist me and to take over care of the patient, it is a big sigh of relief.
Hi.
Hi, how you going?
How much lung does he have?
Is that 4 units now? Yep. We've worked really hard with this patient for the time that we've had him, but it is also nice to be able to hand over to an emergency department where they've got 20, 30 people that are standing around to help him and assist him.
But the battle to save Gavin is a long way from over. His life is now in the hands of the Alfred Trauma Team. 6 weeks ago, 57-year-old Gavin was fighting for his life after crashing his motorbike. The injury toll included 14 broken ribs, a fractured collarbone, and a pelvis smashed in 4 places. Emergency surgery on a collapsed lung got him to hospital alive. But Gavin's wife Sharon and sons Jack and Billy are still coming to terms with just how close they came to losing him.
They grabbed her and Jack and Billy and took them in the room and said, "This is 50-50.
When the doctor said that it's touch and go because he's so broken, I just thought, what am I going to do without him? Life won't be the same. That's what I was thinking.
Yeah, it's hard for them. But I'm here to tell the story. I don't usually cry. I'll be right when I get home.
Oh, I better make the most of it then, eh?
She's got a fair bit. She's got to learn how to wipe your bum,
Oh, no, thanks.
chop your food up.
It'll be at least another 2 months before Gavin can attempt to walk again. As for getting back on a motorcycle, no decision has been made yet.
I've got 12 months or so to think about it anyway.
Exactly right.
He came through. He did. He's a fighter and he's still fighting, but yeah, he'll make it.